Let's go over the three major root causes of ligament laxity and upper cervical instability. My name is Dr. Ryan Emmons, and I'm going to take you through the presentation. Something that's important is to be logical when we are treating difficult conditions. If we are going to effectively treat upper cervical instability, don't we need to know the source or sources of ligament laxity behind the joint instability and assess and diagnose these to then perform the correct treatment? Wouldn't that seem logical? So I'm going to give you a little brief history of our clinic and our successes. So after a decade of treating upper cervical instability, I discovered the three major root causes of ligament laxity that results in upper cervical instability to the level of success of 95% plus when stabilizing patients. We base this success on patients' symptomatic management and restoring neurological function. So, what about the other 5%? Well, this was due to poor compliance, impatience, damage beyond our conservative care capabilities, and lack of belief. I would say the largest factor is poor compliance. Of course, even with my track record, there are still people that choose to create their own treatment plans, do not want to trust the process, and of course, it blends into the being impatient. That's why I did a previous video on understanding and really wrapping our heads around what it is like to recover from upper cervical instability, because if we don't understand what it looks like, we are going to be impatient. Of course, there are a select few people with a lot of damage that is not common in what I see. And of course, lack of belief. If somebody believes that I cannot help them get better or that they cannot get better because they have the mindset of damage and injury, they cannot get better. So let's talk about the direct influence. So when I talk about these three major causes, what makes these causes major? It is that they have a direct, consistent, and potent effect on the ligaments. It's not a random here and there sort of things. It has to be consistent. And for us to term it a major, of course, it has to have the direct influence. So many people like to offer suggestions for other variables or factors that contribute to the ligament laxity, which I am always open, but I have a lot of experience with it. So I can tell you which is the major and which is a minor. And of course, other factors contribute. I'm not saying that they don't. So what about these other factors? Yes, there is a list of minor sources of ligament laxity. So the minor or smaller, maybe indirect sources that can contribute to the ligament laxity. But again, they are inconsistent, indirect, and less impactful than the three major causes. And typically, these minor sources act on the major factors, which is very interesting. Yes, we want to address the minor sources, but there is an order to address the root causes to accomplish this. And yes, there is always an order for greatest success because we want to affect the major or direct influences for stabilization. So we want to go in order to best influence stabilization because, see, here's our goal. Our goal is stabilization. So we want to influence the most impactful ways of getting to stabilization. So of course, yes, there's an order. And of course, we want the majors because our goal is stabilization. So as I mentioned, there is an order of correction. Yes, absolutely, there is an order of correction. Without proper correction, and without proper correction of the order when treating the ligaments, you will need about 5 times as much treatment, if not more. And if it can provide stability at all, that is a lot more. I have been through it personally, so I can speak to this as I have seen it with patients. I have seen it with myself. This is often the reason that there is lack of success and lack of responsiveness to treatment for upper cervical instability, and where patients tend to develop frustration and call my office. These are difficult conversations and stories I hear, uh, and of course, as you can imagine, filled with big emotions. Okay, so what I'm saying here is yes, we have to have that order because then there is a lack of responsiveness and a lack of sustainability to treatment. If you go in order, you can offer a very streamlined solution. So I've always for me, I'm always keeping things logical and as simple as possible. So even better from what I just said, the order goes from simplicity and low cost to more complex and greater cost. Is that not the way we want to do it? Why are we doing it backwards? Right? The current system and standard treatment protocol does not account for this and complicates the process of recovery. Of course, because it's starting with higher cost and more complex, this makes care less accessible for people in need. But it shouldn't be this way. There are a lot of people with upper cervical instability, and so many of them are lost, confused, and they just don't have access to what is believed to be the standard of care. So, what are the three root causes of ligament laxity? Okay, so let's go over these three root causes of ligament laxity and therefore upper cervical instability. Number one, genetics. Number two, stress. And the third one is trauma. They are all treatable, and this is how I see it. So let's get a perspective. Okay, so I see instability as a boat with holes in it. It's sinking. So what are you going to do first? Okay, you need to plug the hole in the boat before bailing it out. That is how I see instability. So what happens is in the current standard, everybody is wanting to just bail it out, bail it out, bail it out. Well, did you plug the holes to control that bailing it out is easier and will be successful? Okay. So I'm going to put an important note here. Whether it's one root cause, two root causes, so we just went over all three, or even all three root causes of ligament laxity, all of them can exist in that manner. Okay. By correcting any and all root causes, though, sometimes the C1 alignment can self-correct and resolve. So, which is the case where we go for the correction of all three of these sources and the C1, which is affecting the neurological structures, it can resolve on its own. However, not always. We must assume C1 alignment does not have a full correction. And if we're treating instability, we have to be prepared for it. It shouldn't be a surprise. You have to assume that just because you stabilize, you should be prepared to be able to also address what is left over from the C1 vertebra impact on the surrounding nerve structures. So this means that even though we have addressed the ligament laxity, yes, we have stabilized, we must also align the C1 vertebra through mobilization or adjustment so that we can remove all compression. Remember, all compression off the nerve structures, not mostly, all of it. After all, the nerves will only regulate and heal with minimal irritation, right? One of my sayings is it only heals if it holds. That means a treatment has to hold if you want complete neurological healing. And this is why I teach some C1 adjusting and mobilizing to health professionals such as chiros, physios, massage therapists, and osteopaths at clinicalupgrade.ca. So let's go over root cause number one. That is, as I had mentioned, genetics. But this is not what you think it is. This is not EDS or hypermobility related, but it is a genetic issue. Okay. This is very interesting. It accounts for 55% of the primary sources of upper cervical instability cases that I see in the office. That's a lot. That was surprising to me, but I track it. So that is where that was and is the current statistic. The good news is that this is the easiest and least expensive cause to test and manage. Can we? Yes. Remember, all three are treatable. If you want to know what this source is, I teach all this content in depth at courses.clinicalupgrade.ca for people that want really in-depth knowledge on how to treat it. Or if you are somebody that's dealing with it and you just want to keep it superficial and have understanding, then stay tuned for its reveal in an upcoming YouTube video. You should subscribe now. Number two root cause is stress. If stress is excessively high or excessively prolonged, it will affect the function of body tissues, especially the soft tissues and ligaments. You cannot underestimate the effect of stress. This accounts for 30% of the primary source of upper cervical instability cases that I see in the office. It is the second easiest and low expense cause to test and manage. And yes, of course, it's testable and manageable. And as we can imagine, 30%, wow, like that's pretty high, but people are stressed and there is a consequence to stress. Do you want a deeper understanding? Again, I teach all this content in depth at courses.clinicalupgrade.ca in my upper cervical instability course, or stay tuned for this reveal in an upcoming YouTube video. Again, subscribe now. Now we're going to go over the third one here, root cause number three, which is trauma, the one that most people talk about. Now, this can be from years of micro trauma or one traumatic incident. This structural version is where most focus is given, but in my clinic, it accounts for only 15% of the primary source. So let me reiterate that. The primary source. It doesn't mean, again, like I discussed earlier, that all three of these can't coexist. All three can coexist, but we have to deal with the hole in the sinking boat. We need to deal with whatever is the primary source of the upper cervical instability in terms of the cases that I see in my office. This is the most involved and expensive cause to treat and manage. Why are we starting here? Mostly it's just because people don't know, hence why I'm doing these videos. If you want more about this and treatment, again, I teach this content in depth at courses.clinicalupgrade.ca, or just stay tuned for this reveal in an upcoming YouTube video and subscribe. So let's talk about these root causes. As I discussed, there is an order. It is not a rigid order, but an order of commonality, convenience, and effectiveness. Sometimes the history will dictate an order. Sometimes testing will dictate an order, and I may pivot. But these are things, again, that I teach in my courses so that you can always keep it streamlined. There are many factors that we can learn in a history that says, oh, wow, this is where I should probably start testing first. Okay. Typically, one of the root causes, like I said, will be the primary source of the three, and the others will be a secondary. It can vary in the ratio and weight of the root cause, especially when it's all three, but you will have a starting place that you need to test. We commonly see two root causes coexisting, but some people, which is less common, will have all three. If you're eager to learn more, I teach all this content in depth. Keep in mind I say in depth because it's pretty intensive at courses.clinicalupgrade.ca. So I have some final thoughts for this. Just because you find somebody online that is familiar with upper cervical instability or cervicocranial instability, maybe experienced it, and even treats it, does not make them the right choice or correct in their approach. It doesn't mean they're bad or wrong. It just may not be the right choice for you if they don't have a vast amount of knowledge in this area. Do they need, so this is a very good question for them. Do they know and treat more than one cause of the ligament laxity or the type of upper cervical instability? What is their success rate? It's very important. And is there a big cost to the treatment plan? If there's a big cost, why are you starting there? You can formulate what to do from there. I've had interactions with several upper cervical instability practitioners, and their fixed mindset and rigid ways are not ideal for providing the best care. It doesn't mean they're wrong. What they do is good. They are helping people, but we can do better. We cannot expand knowledge and awareness this way. When ego is involved, the only person that suffers is the patient. I have seen that over and over and over again. And isn't it about the patient and getting them better? So I have to say this, if you are a practitioner, be curious and please consider learning more about instability to treat these cases in your office because they're going to walk into your office. It is much more common than you know. And if you already treat instability, you must add this to your toolkit, or it is an absolute shame to patients and a disservice to their care. I pride myself on the success that I have with my upper cervical instability patients. I do maintain an open outlook and I'm always willing to learn more. I always make sure that I humble myself and I ask myself, what better can I do? What more can I do? What am I still trying to find? And that is what got me to the place now because I kept asking questions. And I teach openly what can be done so the care can be available to anyone who needs it, not only the people that can afford it. I encourage you who is watching this to hold your instability practitioners to a high standard and insist that they learn more of what I present here to complement their treatments. I'm not saying to change it. It is not to change anything. It is just to add to what's going on so that we can do the best for our patients. Of course, I teach this content in depth at courses.clinicalupgrade.ca. Or if you are watching this just for knowledge, be sure to subscribe because I am going to be revealing so much more in the videos to come. Your one takeaway point from this presentation is to be certain to plug the holes in the instability boat before bailing it out. That means to address the root causes in order and completely when treating upper cervical instability. Don't give up. I appreciate you listening. And as I said, stay tuned because there's lots of great information coming in the next few videos.